Welcome. We know many of you will have already been working with refugees and want to further your knowledge, or perhaps you're preparing yourself to come into contact with refugees for the first time and are looking for information. We're really glad you're here. My name is Paul Cilia La Corte. I'm the London Therapeutic Services Manager at the Refugee Council, where I've been working with refugee and asylum seeking people for 9 years, providing psychological therapy and training. This video is intended as an introduction into engagement with refugees around mental health and well-being to go alongside the resources on this webpage. How should professionals approach conversations around mental health with refugees? It can be helpful to start by connecting with the person, by considering them without the labels of refugee and mental health. For example, considering them as a human being first and a refugee second. Consider safety, which would include psychological as well as physical safety, as they've come from environments in their homeland and doing the journey in which they have not been safe at all. Establish trust, as they have been betrayed by those they trusted. This often includes the government of their country, who, much like a parent responsible for protecting them, is now doing the very opposite and actively oppressing them. What makes us trustworthy is our explanation to the client of what we do and being transparent at all times in what we're going to provide them with. We can establish a therapeutic relationship from an attitude of respect, a warm tone of voice and full attention, demonstrating that we care and appreciate who they are, which can help them to feel accepted. Acknowledge and validate their experience and check their interpretation of symptoms rather than pathologizing them. In most cases, mental health carries stigma, and for refugee people, they may have cultural and religious interpretations of their experience, and it's really important that we respect these. Another conversation that's common when working with asylum-seeking men is around their role as the protector and provider of their family. Many are told at a young age that they need to be strong and therefore have not had the opportunity or indeed permission to talk about their own mental health needs. So it's important that we encourage them and are supportive for them to do so. What is different about conversations around mental health with this community? We believe that it's important to consider the subject of mental health using a cultural lens and to be sensitive how mental health or illness may be stigmatised and be seen as a cause of shame. Given that all refugee people by definition have lost their homes and many have lost and or been separated from loved ones due to violent persecution, it's understandable if they've become overwhelmed with feelings of loss, separation and indeed bereavement. In addition, many have had traumatic experiences during the dangerous journey. As a result of all of this, they may present with symptoms of depression, anxiety, and those associated with post-traumatic stress disorder. We can appreciate that their symptoms are proportionate to these traumatic experiences. I would therefore encourage practitioners to work from this understanding and provide them with the care and support that they need to reconnect with themselves. Refugee mental distress is not typically a result of dysfunctional patterns of relating developed from early relationship issues. And in particular, women go through gender-specific violence, which can include FGM, sexual violence and trafficking. For these reasons, it can be helpful to reframe their experience of psychological distress as a normal response to an abnormal event of persecution. It's important to be mindful of the pathological model so as to ensure that their experience is described as mental distress rather than mental illness. What can you offer to those needing low-level support? Psychoeducation on the importance of helping the person understand their symptoms and empowering them with coping skills, physical exercises as well as mindfulness skills that can include breathing exercises and body scans. The importance of structuring the day can also help to address problems such as sleeping through the day that many who are prescribed medication to help them sleep for the first time describe. As medication works best at night when people are active during the day, it can really help that they do some of these activities. reframing psychological symptoms such as those associated with post-traumatic stress disorder as a normal response to an abnormal situation. Also, to encourage them to get peer support due to the power of sharing their experience with each other. Healthy ways to cope with distress that can enhance their ability to manage difficulties when they arise. What signs should you look for that indicate the person may need further support? In terms of cultural factors, that people may arrive from countries where mental health terminology is different, it may help to understand the severity of their psychological presentation by observing their body language and verbalising their symptoms in simple language, such as talking about depression in terms of sadness and low mood, and anxiety as fear and heightened awareness. Whilst being aware of cultural difference, it's also important to check if their narrative is incoherent, which could suggest fragmented memory. And if there is a high level of self-neglect, this could indicate the person may need to be referred to a higher level of psychological support. How should you signpost them into the NHS for further support? Through their GP, who can refer them to the relevant local mental health service as well as to IAPTs. If your client discloses a plan for suicide and becomes a high risk, it's important that you request an urgent referral by their GP to a community mental health team for a psychiatric assessment. This resource has been created in collaboration with various partner organisations that work closely with these communities. Here you can find further information around principles for engagement, ways to initiate conversations about mental health and trauma-informed practice. We know there are many people and organisations supporting those who have been affected, and we recognise that this is a very challenging time for professionals and volunteers alike working in this space. So it's important that we all are communicating with each other for the benefit of the client. We hope you found this video useful and will utilise the rest of this webpage as a resource to come back to when you need to. By working together to encourage these conversations, we can all help to normalise the stigma around mental health and well-being. Thank you.